Well, as we heard in Carol's report, many are urging Mark Drakeford to lift social distancing measures. But as recently as last month, the First Minister suggested it could be still in force at the end of this year, as the Delta variant causes coronavirus cases to rise. Now, data published today by Public Health Wales shows cases of the variant have almost doubled in a week. But what do the numbers really mean? Are people who are catching the virus now ending up in hospital? And what does that mean for the lifting of restrictions? Owain Phillips has been taking a look.
There are lots of numbers flying around at the moment. So let's take a look at what all this means. Well, back on the 14th of December last year, the number of people catching COVID here in Wales each day peaked at 3,539. Around 2 weeks later, the numbers in hospital with confirmed or suspected COVID was 1,875. And to put that into context, it was responsible for around a quarter of all hospitalisations. So back in December, during the second wave, there was a clear link between those catching COVID and those ending up needing hospital treatment. So if you fast forward to today, there are 481 confirmed cases, and hospitalisations at the moment stand at 86. But it's worth remembering there was a lag between both in the first two waves. One statistician and former Reform Party candidate who campaigned against some restrictions says the link now between both has been broken because of the vaccine.
So the vaccines clearly are working. They've broken that link that we've had in the past between cases, hospitalisations and deaths, which is really important because when we're seeing rises in cases like we're seeing now, I don't think we need to have the same alarm that we've had in the past. And the policy should be probably driven by what's actually happening with hospitalisations and deaths rather than just cases.
The Welsh Government have regularly said they need to see more conclusive evidence before easing restrictions further. And vaccination rates continue to increase, with nearly 90% having had one jab and 66% having both jabs, which is still seen as key to ending restrictions.